Hey guys, this is Michael from Nomadic Insights. One of the things I promised was that we were going to go through healthcare in Spain. So, we're going to go over two parts of the Spanish healthcare system today. One is the public system, and the other is the private system. So, the first thing that you're going to want to do when you get to Spain, if you're working, is make sure that you're registered with Spanish Social Security. You're going to need to register with Social Security for pretty much anything healthcare related, and it's important to make sure that your employer is actually paying into your pension and all these things. So, under Trabajadores, there are a number of different applications that you can fill out, but this will take you through the different parts of Social Security. So, the biggest part in Spain is you need to make sure that you're affiliated or you're registered with Social Security. This affiliation gives you the right to access healthcare in Spain. Now, Spain does give everyone access to basic healthcare, but if you are registered as working in Spain, you want to make sure that you're in the Social Security system so you can apply for your tarjeta sanitaria in the comunidad autónoma where you live. So if you live in Andalusia or Madrid, you're going to need a tarjeta sanitaria from there. So first step is make sure you are registered with Spanish Social Security. So that's the first way to access the public system. Now, if you're coming over on not a work visa, but a different kind of visa where you'll be, you'll either be self-employed because you have an entrepreneur visa or you're on a non-lucrative visa, you're going to need private insurance. So let's take a minute to talk about private insurance in Spain versus public. So everyone in Spain who pays into Social Security has the right to a health card or to health access, which means you're going to get the discounted prescription pricing and all the other benefits of having a healthcare card in Spain. The problem though is if you're not paying into Spanish Social Security, you don't really have full access to the healthcare system in Spain. So you are going to need a seguro de salud or a seguro médico. Now, big thing here when you want insurance is when you go to apply for your visa, you must get the best policy sin copago. So you cannot have co-pays. You need to have a complete insurance policy that is equal in coverage to Seguridad Social. So you need to have the same levels of coverage. Not every private policy is valid for trámites de extranjería or for applications to the Spanish Foreigners Office. So very important, you need a policy that is fully valid for extranjería. So Sanitas has a network of private hospitals in Spain. It is one of the more it is the most expensive option of the three major healthcare providers, healthcare insurance companies in Spain. They have a very robust telemedicine offering, and they do generally have providers in English as well as very nice hospital facilities if you live in Barcelona or Madrid. Very nice. The number two or number one provider, it really depends on the year, is Adeslas. So they provide, health insurance. You're going to need to end up probably with, yeah, you need an integral coverage. Can't have ambulatory, so you're going to need, they're probably, I think you need plena if my memory is correct, because this has no copays, so you're going to get complete coverage for pediatrics, um, general medicine, urgencies, hospitalization. There are waiting periods of like 6 months if you need surgery on these private insurance. You know, prenatal testing. So it's fairly robust coverage. Then my favorite company in Spain for insurance is Mapfre. So they do not have as pretty a website as Adeslas or Sanitas. I had Mapfre the entire time I was in Spain, had my home insurance, dental, pretty much anything insurance wise I had with Mapfre. Their Te Cuidamos program is really great. I am a big fan of Mapfre, based on the great customer service experiences I've had. Adeslas, not so great, and Sanitas makes you pay once you're a client, so you're going to need to pay to call them, and they're the most overpriced insurance provider. Kind of sucks. So Mapfre does not charge you for customer service. Adeslas does. Canceling a policy that one of my friends had through them was horrible. It was horrible. Just Mapfre. You don't need to pay for customer service. Very responsive, very nice. I recommend Mapfre if you're looking for kind of the VIP treatment. Sanitas, but just bring your wallet because you will pay for calling customer service. So just either go to an office and don't try to use a phone number. A little hard with COVID. Maybe they've stopped charging for customer service, but I doubt that. So that's just my thought on healthcare in Spain. So again, if you're using this for an insurance application, you need insurance with no copay, and that gives you equal coverage to Seguridad Social. Honestly, if you're doing an extranjería application and you're not a student, just hire a lawyer. It's going to make your life much easier, because in Spain, the rules can be a little, they vary by province. So insurance requirements, you could be in Barcelona, they'll tell you one thing. In Madrid, they'll tell you another, and it varies between the offices. Just, if you value your time and your sanity, work with an expert in Spanish immigration law. It's the same thing as going to the United States. You want to work with a lawyer. If you cannot afford a lawyer, you want to really do your homework, because it can either be easy or it's going to be a nightmare. It usually, dealing with functionarios in Spain's its own reward, so you'll find out when you get there what I'm talking about with a functionario. Fantastic country, but dealing with immigration law in any country is really tough.